I'll start off with you, Alex. You and Laura talked a lot about employers' health and safety obligations at this time during COVID-19. How do those obligations apply when employees are working from home?
Well, in a lot of ways, they apply exactly the same as they would in the traditional workplace or the centralized office. So as you said, Joel, millions of workers have now transitioned to working from home, but when they're working from home, home is the workplace. So all of the types of health and safety obligations that Laura and I discussed still apply. And essentially the same level of safety as is required in the centralized office would be required in a work from home context, but as you said, this is going to be harder for the employer to actually meet these standards because the employer isn't there. Managers aren't there. They can't see. So the employers are going to have to ask themselves a lot of the same questions to assess their work from home related health and safety risks, such as, are there cords and cables causing a tripping hazard in the home office? Is there a smoke alarm on the premises? Are there first aid supplies somewhere? And they're also going to have to think about injuries related to ergonomics, because as you mentioned, a lot of these millions of employees just picked up and left. So they may not have the proper equipment at home to work from home and be sitting for extended periods of time. And depending on why the employer's workplace was shut down, they may not have had a chance to go back to the office and take equipment. Other health and safety concerns that are going to be perhaps a little bit more prevalent in the work from home context than in the traditional workplace are things like alcohol and drug related concerns. So interestingly, a poll commissioned by the Canadian Centre on Substance Abuse and Addiction recently has said that 25% of Canadians between 35 and 54 years old have increased the amount of alcohol they drink while at home during the pandemic. And 21% of Canadians between ages 18 and 34 have done the same thing. So these are working age Canadians, and we're not sure what times of the day they may be drinking, but they may be doing so while the employer would be expecting them to be engaged in their regular workday. And again, this is just something that's not easy for the employer to monitor on a remote basis.
Thanks, Alex. Now, as I mentioned earlier, it's been widely reported around the world and in Canada specifically that incidents of domestic violence have been on the rise since this pandemic began. Federal consultations in Canada suggest there's been a rise of about 20 to 30% since the pandemic started. And of course, that significant increase is probably low, given domestic violence is well known to be significantly underreported. Do employers, I should say, have any obligations to protect their workers from domestic violence when they're working from home?
Absolutely. So as employers will be familiar with, jurisdictions across the country require employers to protect employees from workplace violence. Now, in some jurisdictions like Ontario, domestic violence is specifically addressed under the legislation. In others like Alberta, New Brunswick, and Newfoundland, it's specifically mentioned as a subset of workplace violence. And then in some jurisdictions, domestic violence specifically isn't mentioned. But again, as I said broadly with respect to health and safety, when you're working from home, home is the workplace. So domestic violence would be workplace violence. But again, this is something that's very difficult for employers to address because they may have not faced it very frequently. They may be facing potential domestic violence situations more now with the incidents increasing, as you've said. And employers and their frontline people leaders just may not know what warning signs to look for. Plus, they have fewer touch points in a remote kind of workplace. So signs like impacts on productivity and an employee becoming withdrawn that may signal issues related to domestic violence are also going to be confusing now because they could as well be related to stresses due to the pandemic.